improved on antibiotics, and if they have, it may be worthwhile going down that road. Although there's other reasons why you could improve on antibiotics, such as mycoplasma and other bacteria that can contribute to chronic fatigue syndrome. But no, chronic fatigue syndrome is not caused by Lyme disease, but if you have Lyme disease, you certainly can have profound fatigue, which will mimic chronic fatigue syndrome. My own personal take on this is that if you've had a year, or if you've had treatment for Lyme disease for significant periods of time, and you have not improved, you need to move on and see what else can be done. Either contact us or another specialized clinic, and let's work on other factors of your chronic fatigue syndrome. Unfortunately, I do see people where they had a year of antibiotics for Lyme. It's not clear they had Lyme in the beginning, but now a year later they're seeing me and they do have an overgrowth of candida from the antibiotics. Their fatigue has become worse, and we have to repair the damage from all of the antibiotics. So that is a difficult question and a difficult answer. And again, you need to have specialists probably in both. And any of you out there who have been diagnosed as possible Lyme, I certainly would be happy to talk with you about your case and give you my take on whether or not this could be Lyme or chronic fatigue or what I believe is going on. Once again, nothing can replace a one-on-one consultation where I can review your history, do a physical exam, and get your lab work specific for you. Next is from Dead in Bed. It doesn't say what state. Will my memory ever come back to being normal as it was before I had CFIDs? Will I be able to depend on living again without feeling deadly ill in bed for hours or days? Thank you. Donna D. from Michigan. Yes, Donna, your memory should come back once the CFIDs improves. You may have some problems with our memories have to go into short-term memory first, and then they're entered into our long-term memories. And our short-term memories can be selective and delete things we don't want to put in the long-term memory. So I have seen some patients who've had problems because their short-term memory was so bad through the years of CFIDs that some things didn't get entered into the long-term memory. But in general, as we talked about earlier in a question, as your cognitive function improves, usually the memory improves. And again, there's numerous supplements and natural treatments available for that, and I would be happy to discuss your specific case on that. Certainly improvement of the Krebs cycle and working with that to improve your energy. Sometimes even treatment of viruses or bacteria if you have those infections. Certainly treatment of yeast can also contribute to cognitive improvement and therefore memory improvement. Next is from Ariana C. Since so much of chronic fatigue and fibromyalgia comes from a sick bowel, how does Dr. Conley feel about colon therapy? Ariana, I have worked with chronic fatigue and irritable bowel, so quote-unquote irritable bowel syndrome, for 25 years. Treatment of the bowel is so important because, as the advertisements are now telling us, which we knew 25 years ago, 2/3 of your immunity is centered around your bowel. Therefore, if you have infections of the bowel, parasites, abnormal bacteria, overgrowth of yeast, the immune system is going to be ramped up, overproduce pro-inflammatory chemicals, and lead to fibromyalgia and chronic fatigue. Replacement of good bacteria, treating those parasites or yeast overgrowth or bad bacteria overgrowth is vital. Restoring the bowel to normal function, giving it the nutrients it needs to repair itself, are all things that we've done at this clinic for the past 25 years. I wholeheartedly approve of them. And so there is a science in doing that. And it's not easy, which is why so few doctors do it. Actually, rehabilitating the bowel takes many months, indeed, usually many years. But that is definitely a place to start if you have chronic fatigue syndrome and IBS. Last question briefly. Comes from Allison B., Houston, Texas. In the 10 months since having EBV, I've found no help for all the symptoms that I've had for many months. Now I have episodes of fatigue, my sleep, certain hormones are out of whack. All this makes it difficult to work full time and help my family. What tests and ideas for treatment would you recommend for my recovery? I had hormones tests done 8 months ago at a regular endocrinologist and everything seemed normal. But I'm not sure what was done. That's a complicated question, Allison, but there's a lot that can be done for you. First of all, as I mentioned earlier, you need to understand that there are treatments for Epstein-Barr. So question number one is, do you still have chronic active Epstein-Barr? And if you do, there are both prescription and natural treatments that we could discuss. Number two is that hormones play a very important part in chronic fatigue. And many women start or worsen chronic fatigue as they go through change of life because they are barely hanging on, but when the ovaries stop working, then you folks will have to pardon me here, my allergies are acting up today. When the ovaries reduce their function, all the work falls back on adrenals, and many people that I see in this clinic have adrenal fatigue, so their adrenals just can't handle it. And so you start to get drop in very important hormones, estrogen, progesterone, testosterone. Then you get drops in other important hormones like DHEA and cortisone that are produced in the adrenals. All of those hormones are very important for energy production, brain function, neurological, nerve function, and more. I know most people think about the quote-unquote sex hormones for reproduction, but they are vital for energy production, for brain function, for neurological function. There are receptors on your immune cells and in your nervous system for estrogen. So